And of course we have someone who can make the Spice Girl connection. Sorry, Mel.
Yes. You did have to say, Rod, you did use the stop and the reference. I was like, damn it. But yes, there we go. That's my only reference to Spice Girls is my name. Right. So in terms of background and context for this, I'm the lead for technology and counselling for the Faculty of Health and Wellbeing at Sheffield Hallam. But my background is actually within physiotherapy. So Nicky and I worked together to rewrite our postgrad programme over the last sort of 18 months or so, wasn't it? And then my last day as a physio before I took up this post was me submitting the validation document. And I was like, fine. And then went into my new job, which was just great. So what I wanted to talk about really was how we developed the programme, but also how we've then used screencasting for summative assessments with our postgrad students. So Rod's been talking about formative, but Nicky's been using it in one of her modules. So in terms of some of the challenges we faced, physiotherapy, whatever your perception of physiotherapy, before I came into physiotherapy, I kind of envisaged someone running on a pitch with a wet sponge. But it's a little bit more complex than that. But one of the things that was conceptually hard, wasn't it, was actually getting our academic colleagues to think of physio not just as a practical subject. And so when we wrote this document, we had a big international postgrad cohort that was dwindling, but we also had more and more students who were struggling to get time off work and access our face-to-face. So we had to think creatively, but the biggest barrier was really our colleagues saying, well, you can't deliver purely DL modules, and we had done a few, hadn't we? In terms of some of the theoretical modules we did DL, and we were quite proficient in, but we made the decision to run every single module, and we wrote every single module with a face-to-face version and a DL version. So there were separate module descriptors, separate module codes, but the same learning outcomes, and we decided to be a bit creative in how we would achieve those learning outcomes. And that took us the longest, I think, to get people thinking about. And some of the comments this morning around if you can make it work DL in terms of the interaction and stopping people doing lectures for hours on end and then just sticking them online, and thinking about that dialogue and that interactivity, it improves your classroom teaching. I think that's been an approach we've taken in terms of, okay, forget the face-to-face, we've done this for years, we know what we're doing, really think about how you design your DL, and that will actually help you face-to-face. And that's been something that we've tried to work with our team to do. Excuse me. So I suppose that's really our background. Do you want to start talking about the module? Is that okay?
Okay, so I got the task of module leading the first module on the new course. So I was running one module distance learning and the second module face-to-face, so the same module but with two very separate deliveries. The aim of the module was to help the students understand patient assessment, as in how to do that collaboratively, how to use your clinical reasoning to decide what to do with the patient when you first meet them and how to treat them. So the assessment was an assessment that we've used sort of for similar modules for years. So what we were used to doing on the face-to-face one was basically half an hour with a student. It's only a 15 credit postgrad module. Half an hour with a student, they present to you for 15 minutes and you then viva them for 15 minutes. So basically what we did with the distance learning module was go, well, what's a similar way of doing that in a DL format? So what we decided to do was have them present, but as a screencast, and then give us a little bit of time to look at that screencast and actually do their viva a week later. So we're already looking at difference between how the assessment was experienced by those two different groups. So the distance learning students, they record their screencast, and then they wait a week, and then there's a quarter of an hour viva with a member of staff on the same patient. So it's a patient case study they're presenting to us.
Was that done by Skype?
Yes, the viva was over Skype, yeah. Okay, so I think from our experience, there's a few things that we felt were interesting that we wanted to share. One of them was how little support we gave the students. And I don't mean that, I don't want to show off like we don't support our students, but they didn't need very much support. So really, this is all I put on the BLE. You know, the simplest way, so I didn't force them to do a screencast. The simplest way to do this is to do a PowerPoint and record an audio over it. Okay, and I then said, you know, if you want to include patients, this is what you need to do legally to do that, but you also might want to film yourself talking, or you might want to do a screencast. And then we didn't try and sway them either way. We just said, do whichever you're comfortable with, really. And I think it's important to note that on the module, their teaching was primarily the most video that we used was screencast video, so that was what they were most used to seeing. And I think that could have impacted upon what they choose to do. So it was only a small cohort. We had 12 students. 7 of them chose to screencast. 3 of them chose to do a PowerPoint and record a separate audio that we just listened to whilst watching the PowerPoint. 1 chose to do a PowerPoint and actually attach the audio clips into the PowerPoint file. 1 chose to use Articulate. So students chose what they felt familiar with, and that was partly from watching what we were doing on the module, but also if they had used something to create a standalone presentation in the past, then that would be what they tended to want to do. So very little technological advice given to them, and I think there was probably only 1 student who suffered from this, in that 1 student believed that she would need a camera in order to produce a screencast. You know, I don't quite know where she'd got that from, but it was, you know, clearly lack of confidence with technology. And no students chose to video themselves. Nobody wanted to submit a video of themselves. Most had no prior experience of screencasting. 1 international student had used QuickTime before, so that was what he chose. 1 UK student chose Articulate because he'd used it as a university lecturer. So out of the 7 who screencasted, 1 used QuickTime and 6 used Screencast-O-Matic. I asked them about how they got on with it. 1 student took 2 takes to record it, 1 student took 3 takes, and then the others were saying loads of takes. I stopped counting. I would watch it and go, that's not good enough, and then I'd re-record it. So a lot of the students were spending much more time preparing this presentation than they would have done if it was a face-to-face thing, which they would have been much more familiar with. The main reason that students gave me for multiple choices, though, was managing the time limit imposed by the module, which was actually only 10 minutes. So I think that was where a lot of the effort came in from them. The students gave us feedback on how they got on with it. Most said it was, well, they all said it was really easy to set up and use. So everyone who tried to use it found it really usable, which I thought was really good. And I thought this was lovely. One of our students who works in a UK rural setting actually said, we've enjoyed, you know, you've shown me how to do this. I'm now going to actually use it for in-service training across the, you know, we've got people who work all across these little seaside towns in East Yorkshire. We're actually using this now within our training. The chap who actually used Articulate actually said, I almost wish I hadn't, because I quite liked the simplicity of the screencast, and the fact that I could see your cursor moving around while you were talking actually gave me something to sort of direct my attention. So I could see the simplicity of that, and I could see the advantages of that. I do think, they didn't actually say this, but there was some of the things that people said back to me made me think that they had worried a lot more about the presentation than they would have done if it had just been a face-to-face. I think that's partly their comments about many, many takes before I felt it was good enough. And also people were saying, I appreciated being able to listen back to what I had done. I felt very proud of it when I'd finished it, but I didn't really like listening to my own voice now. We all know what that's like, I think. That's something everyone has to get used to when they start doing online stuff. So we had 2 different markers marked these, and so I was one of the markers, just one of my colleagues marked as well. It was really nice to listen to it more than once, but I think this in itself raises some issues of parity, and we're going to go back to a discussion on that in a moment. So when I was marking these, I would actually listen to them and pause. Whereas obviously if you've actually got a student in a room with you and they're giving a 15-minute presentation on a patient, I can't press a pause button on them. I can stop and listen and have a little look at their handout and go back a little bit if I've missed something, but then obviously I'm missing the thing that they're saying next. So pausing was actually really helpful, and therefore it could have enabled more details to be noted in the distance learning presentations than possibly in the face-to-face presentations. The various formats were equally easy to watch and mark, so the PowerPoints were no more difficult to watch than the screencasts, not a problem with those at all. And then the other positive thing I was happy with, that there was no problems with file size. So the file sizes obviously were a lot bigger than handing in an essay, but the Screencast-O-Matic screencast came in around about 20 megabytes, the QuickTime one came in at about 42 megabytes.
And so I think what I really appreciate your thoughts, feedback, comments on it is one of the things we got quizzed at a lot at the validation events was making sure that the DL provision was as good as the face-to-face. Now what we actually feel is that the quality of the learning that's been demonstrated by our DL students and the way we're assessing them, we're wondering actually whether they're coming across, although they're being given better opportunity to demonstrate their learning, partly because they get a chance to do it more and more times before they submit it, partly because we get a chance to pause. And then, I suppose my question to you guys is, does that really matter in terms of it's about demonstrating the learning outcomes against two very different modules? They might have the same learning outcomes, but we've already designed different assessment strategies anyway. So are we trying to offer a parity, or are we being constrained by the need or the perception that we should replicate exactly? And this is kind of the challenge we've had with some of our teams saying, well, it's not exactly the same experience, and have you advantaged some of the DL students over the face-to-face now, versus people saying, actually, does it really matter? Because it's a different module and they're achieving the learning outcomes. And this is where I really wanted a bit of dialogue from you guys, with this, in theory, being a workshop in a lecture theatre. That was, I think, our interesting point was, and you were saying as well, the students who did screencast generally got higher marks than those who submitted PowerPoint, and it was moderated as a module, so it wasn't that we were biased, but is it that because of their skills they were more engaged in the module and the different learning resources, and they felt more capable, you know, and as I say, that's what I just wanted to throw open really, is kind of your thoughts about, do we have to replicate things exactly? Do we think that DL sometimes offers a greater opportunity for people to demonstrate their learning?
Okay, we have time to answer that question. I think it's a really good question. So let's just take a couple of minutes, but we're going to stay in this room after that, and I'm just going to get everyone else to bring them in here. Do you mind holding that and taking it around?
Sure. Do we have any questions? I'll make a point then. I've had exactly the same thoughts about asking students to use different submission techniques for the same assignment. So I mentioned at the end of my presentation, I allow the students to make a choice between whether to submit a written reflection or a video reflection. So far, I'm quite confident that what I'm doing is testing the same things, because I'm still assessing them against the unit learning outcomes. But I have started to notice that, I don't know whether it's a reflection of the fact that I'm working with academic colleagues who are used to doing presentations and are used to expressing themselves orally, but we're getting much deeper reflections and much better performance, or what appears to be better performance against the learning outcomes in those oral reflections than we are in the written reflections. So we're wrestling with the same sort of, we think we're testing the same learning outcomes, but...
Yeah, I mean, at risk of preaching to the converted here, I get a little bit frustrated by the assumption that we have to kind of have online programs that are coming up to the standard of our face-to-face programs. Because, I mean, I've studied degrees online and face-to-face, and it's a very different experience. And for some things and in certain circumstances, I absolutely believe that DL or online learning is superior. You know, that it can do certain things better than a face-to-face program can. And, you know, so yeah, I agree with your observation.
If you have noted that you've got better learning from the students on the distance learning programme, and if your learning outcomes are the same, why would you not introduce that form of assessment for your face-to-face students?
That would probably be my next step in terms of with module and course review, is I would get the course team to start reflecting on that themselves and say, are we giving them the best assessment strategy in face-to-face for them to demonstrate their learning? I completely agree. I'm not quite sure the course team are quite there yet. And I think we need to do, we've only got a sample of 12 and we've only done this once, so I think we would need a better body of evidence. But I agree, I think it does give us the opportunity. And as a course team, we have what we call module laundry every year, where we go through our modules and we look at what perhaps needs to change. And I think we do have some quite frank discussions, and that would be the opportunity to challenge it. But
Your students then?
Well, there were two very separate cohorts, so one cohort doesn't actually know what the other cohort really experience at the moment. We have other modules that are mixed better, where the two, the DL and the face-to-face, we're trying to get more. But because it was my very first go at it, I kept them very separate. The DL student, I've had really strong feedback from both cohorts, to be honest.
Strongly positive?
Strongly positive, yes, definitely. Yeah. So the overall satisfaction levels were very similar between the two. The marks were very similar between the two. It's about 4% difference, with the DL being slightly better than the face-to-face, but that's not going to be significant really. So I'm not sure that they would know. I think for our face-to-face students are primarily full-time international students, and I think they would be quite scared by the idea of recording a presentation. But actually, they're really no different. They just happen to be in Sheffield from a lot of our distance learning international students who are spread around the world. So I don't think it would be any more frightening for them. So, yeah, it could be worth a go.
What about you as markers? Did it take longer to mark those DL presentations? I could see people complaining if something like that was brought in, and if you're looking at it twice or more.
Yeah, it probably was taking me longer, but again, I don't know whether that was just because it was the first time I'd marked that time round. It would be definitely something to monitor, I think.
And I think the way Rod's used what Rod was saying earlier, as soon as he said, "Oh, and I can see how they've made the change," and that actually is a selling point for speed of you as an academic getting back up to what you'd recommended and what they've changed. I know it's a very different context, but I could see that use as actually a selling point for time efficiency, because it just quickly got you back into the headspace. But in our context, possibly not.
Shall we? Let's stop.
Nobody else?
Yeah, is that a good place to stop?
Well, there was a few other hands, but we're not going anywhere immediately. So
we're just waiting for people next door to come back in. So
do you want to?
Be nice, Simon.
I'm always nice. I was going to say, the kind of point you made about the students that recorded it over and over again,
Yeah.
kind of getting reflection by stealth almost there, because they're listening to themselves, they're thinking, oh, I sound horrible, I'm going to do that bit again. But actually, they're listening to what they're saying as well and what they're actually coming up with, rather than just how they're sounding.
Yeah.
So it's forcing that reflection in a kind of stealth way of doing it. And actually, that's quite a nice way of doing it.
It's sneaky, isn't it?
It is. That's the best way of doing it. Is that nice enough?
Yeah, that's great.
Brilliant. Thank you to Mel and your team. Thank you.